Okay, so thank you everybody for joining us today. Today we have Rose Morales with the California SMP. She is a case investigative analyst, and we also have Tatiana Facio. She is a training and education specialist with the SMP, and they are going to be sharing information with you all today. I will be sharing my screen so that you can see the slides. I will also, if it's okay with these ladies, send you a copy of the presentation after the fact, along with a link to the recording. If you have questions as we go along, feel free to drop them in the chat, and then we will get to as many questions as we can at the end. Okay, can you all see my screen? Great, so Rose, I believe if you would like to start.
Thank you, Nina. Hello, everyone. My name is Rose Morales. I am a fraud investigative analyst for the California Senior Medicare Patrol. I am joined today by my colleague, Tatiana Facio, who is our education and training specialist. And we are here today to provide you with some updates on the California Senior Medicare Patrol. Next slide, please. California SMP is one of the 54 Senior Medicare Patrol programs found throughout the 50 states plus U.S. territories in the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands, working together to fight Medicare fraud. All of these programs are federally funded through the Administration for Community Living under the Department of Health and Human Services. Our mission in this program is to empower and assist our Medicare beneficiaries and their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do this through outreach, counseling, and education. Next slide. The California SMP grant is administered through our home agency, the California Health Advocates. CHOP provides quality Medicare and related healthcare coverage, information, education, and policy advocacy. I encourage you to visit our website and browse through our wealth of resources and information. Next slide. SMP's motto is to prevent, detect, and report. SMP follows a three-step approach, and that is prevent medical identity theft by guarding one's Medicare card, detect errors by reviewing Medicare summary notices, MSN, and explanation of benefits, EOB, and report suspicious billings by calling the California toll-free SMP hotline at 855-613-7080 and the national hotline at 877-808-2468. I will now pass it off to my colleague, Tatiana. Thank you.
Thank you very much, and we'll follow through the next slide. It's a pleasure to be here and inform the participants on the trends and what is happening in particular in California, but for that matter, all over the country. And it all starts with the Medicare card. Whether a person is enrolled in a Medicare Advantage plan like Kaiser or some kind of other HMO or PPO that is a Medicare Advantage plan, that card, that Medicare card, is still the key to protect, because it is with that number that scammers are able to bill Medicare for unneeded or unwanted services, but also enrollment into plans that may not be adequate. So how do you guard your card? Basically is keep it with you when you're going to go and see a medical provider. Otherwise, it's, there's a sort of a two-edged sword, because what happens if you need to see a doctor in an emergency basis and you are in regular Medicare, we call it original Medicare, and you need to present your card. So it's but guard it. Do not give this number out to anybody that does have no business knowing. You need to be proactive in identifying anybody that calls you to verify that they are accurate, that they have business with you. So I will follow through with the next slide, please, where we'll talk about the trends. Okay, so we just finished back in December. It was October 15th to December 7th, where was the Medicare open enrollment, where people could make changes to their Medicare coverage. Well, you see the television commercials, you get a ton of mail, cold calls. In particular, those commercials and those print ads that are very, very deceiving, because they don't tell you the whole story. And in particular, we want to make sure that you as participants do not succumb to a cold call offering you all of these additional services that Medicare, in particular, a Medicare Advantage plan, would promise you, but it may be not appropriate for you. So we are really deputizing all of you to monitor those questionable commercials, print, cold calls, because SMP wants to know about them. We're not on TV all the time. We know certain times of the day where older adults are watching either the soap operas or they're watching game shows. And you will notice those commercials much more heavily broadcast than other times of the day. So if there was a way, if you have a smartphone, you can take a picture, or if somebody calls you and you on your phone has caller ID, just maybe jot down that phone number and ask them, who are you? Because Medicare is not going to call you. Social Security is not going to call you. So watch out. Another one, as Rose had mentioned, is the billing issues. We have noticed, and we have received reports, that certain home health agencies are being pressured to overbill Medicare for additional services not given. And how do you know as a Medicare beneficiary whether somebody whether a provider has overbilled? If you look at that explanation of benefits, look at that Medicare summary notice. When you get it in the mail, don't put it in a pile. Look at it. We are empowering you to be our eyes and ears of fraud. And if something does not look right, give SMP a call. Another particular problem that is really very insidious is enrollment in hospice. Hospice is a Medicare program that is really meant for people who are in their end of days. It's to provide you with comfort care if there is no hope of recovery. And these deceptive hospice enrollments have promised all sorts of additional benefits that are only available to people who truly are in their end of life stage. And what happens if one gets enrolled in a hospice program? you can no longer access your regular care. We've had people report to SMP that their cancer treatment was stopped because they were enrolled in hospice. So beware. Medicare card phone scam. Medicare is not replacing your card with a new plastic card. Medicare is only going to send you a new card if you request it because you lost it. Genetic testing scams. A lot of people want to know if they are genetically predisposed for certain cancers or other illnesses. Well, there've been a lot of those scams where either callers or somebody at a senior center is invited to speak because the senior center manager does not screen those individuals with whether they are scammers or not. In your own residence complex, hopefully the your senior service coordinator, you are the senior service coordinators, be aware if anybody comes to your facility and say, oh, I'd like to talk to your residents about the genetic testing that Medicare is now covering. Well, Medicare only covers it when there is a true medical necessity, and it is very difficult to get that authorization. But somehow these scammers have figured out a way to solicit a provider that will sign off on getting that. And sometimes it's not even a genetic testing. They'll swab your phone, your nose or your mouth, and then nothing happens. So be careful. COVID test kits. We've had reports of seniors getting 5, 6, 7 packets of COVID tests totally without requesting it. We know that the government, especially through the post office, has restored sending out a small supply of COVID tests. But we've had older adults report to the local HICAP, the Medicare Counseling Program, that they received unsolicited 5, 6, 7, 8 kits. And guess what? You're not paying for it, but the taxpayer is paying for it through that billing. And so all of this fraud is happening. And what it does, it's using taxpayer dollars to pay for these services, and it increases the expense that Medicare is having to put out unnecessarily and jeopardizing the future of Medicare. Next slide. So these are some of the tips that we would like you to be empowered with your residents. Marketing rules have been strengthened with new regulations. However, the bad guys don't care. So we want you to look out for, when you get your magazines or you get any kind of newspapers or mail for your residents, or your residents come to you and now say, hey, look at this. I have now received this. Is this true or not? Watch out for that, because at SMP, we want to have a copy of that. Look at, report any kind of marketing of benefits that seem to be too good to be true in areas where those benefits may not be available. The superlatives, this is the best plan ever, or you will be able to see most of the providers. All of these superlatives are a way to capture that individual's interest, and they could get sucked in to enrolling in a plan that may totally be inappropriate for them. Cold calls. Those cold calls are not supposed to happen, but we've had cases where it's either coming up on their caller ID as healthcare, or I've received those type of calls too. Well, this is your healthcare advisor. Well, it's all about getting your Medicare information. So it's the term spoofing is pretending to be from a government source, which they are not. Look at the advertising or the media promotion that just looks too good to be true. And I've got some examples. So here's again the phone number to call the Senior Medicare Patrol to report it. 855-613-7080, or nationwide. You may have friends in other states that they could call 877-808-2468. So we want to see examples of those type of too good to be true commercials. And the next slides. This is a commercial that I saw myself. I rarely watch TV, but Humana Medicare Advantage was this particular commercial was broadcast January 7th, 2024. But I did a Google search and I found that this was used heavily during the annual election period last year, but even the year before. Free rides to medical appointments. Yeah, who wouldn't like to get a free ride for a medical appointment? But these commercials are targeting dual eligible, meaning people who have Medicare and Medi-Cal, and they're highlighting these extra benefits. In essence, in very fine print, it does say benefits vary by plan. Plans may not, it says here, plans may not be available in all states. Please call to check for availability. And in bold is that phone number. They want you to call them. Because, and again, I know we've got a mixed audience here, but any commercial that gives you the message, call, that's the hook to sell you products and services that you may not need or may not be appropriate for you. So this particular commercial, and it doesn't even have information that this is a Medicare plan. So that already is a, in the words, they do say that. The next slide. This is also heavily marketed. You could get up to $3,300 in a sort of a debit cash card that you can use for food or other products and services. But bottom line is this plan right for you? Are all of your doctors in that network? Can you indeed change to this plan outside of your regular open enrollment? See, those are the follow-up questions that one has to think about before calling that number. Because yes, I'd love to have a card that gets built up to $3,300, but guess what? I may not be able to see any doctors because none of them belong to this plan. Next slide. So the Medicare Advantage open enrollment, which is right now, January 1 through March 31st, is for people who already are enrolled in a Medicare Advantage plan, whether it be an HMO or a PPO. But these heavy television advertising approaches are targeting those that could change to their plan. But again, they're touting those extra benefits as the hook and not even mentioning, you better check with your doctors to see that they're in this plan. Another pitfall is medical groups like Sutter Health or some other medical group. They're promoting Medicare Advantage plan enrollment because they get extra money from the plans. But the problem is, like what we're finding in Northern California, that Sutter Health is quite prevalent. They're only accepting new patients if they are enrolled in one of their preferred Medicare Advantage plans. So what happens? You move into your nice facility because you're eligible, and now you can't see any of your doctors because you enrolled in the plan. Telephone enrollment during a cold call. These cold calls are so insidious because they pretend that they are legitimate from either Medicare or some other plan. And the cold calls bypass the restrictions that are placed currently for marketing, in that you have to sign a document saying, yes, I want to hear your marketing pitch. Cold calls have insidiously enrolled low-income beneficiaries or others in a plan because, yes, I'd like to know more about what services I could be entitled to, but just when the moment says, well, in order for me to give you this additional information, I need your Medicare number. No, they don't need your Medicare number to give you information about the plan. The moment you give your Medicare number to somebody that calls you, or even if you call them because you got a postcard, and I'll show you an example. We've had hundreds of people, of Medicare beneficiaries, who were enrolled inappropriately because of those cold calls. During open enrollment, January 1 through March 31st, if you have a Medicare Advantage plan and you want to get out of it, and you want to go back to regular Medicare, you can do that. You can go back to regular Medicare, or maybe find another Medicare Advantage plan that would be appropriate for you. But if you go back to original Medicare, there's a problem that you may not be eligible to enroll in a Medicare supplement, also known as Medigap. They have what is called guarantee issue rights. Some individuals are eligible to get a Medicare supplement without underwriting, meaning without consideration of your pre-existing conditions. But not everyone during this period is eligible. So that's why we suggest, if you're really dissatisfied with your Medicare Advantage plan, before you do anything, call HICAP, because we don't want you to succumb to that cold call that put you in a plan and took you out of a plan that you were perfectly happy with, but just because they were promising transportation, that was the hook. So if you missed that previous open enrollment that ended December 7th, and you want to change your Medicare Advantage plan, this is the time you call HICAP. Next slide. So these are examples of what Medicare beneficiaries have been targeted. This is one, insidious. Look at that. It says Los Angeles County Medicare Benefit Update. This looks very official, that is coming from LA County. No, it's coming. Read the fine print, because it's coming from a solicitor. It could come from an individual agency that sells Medicare plans, or it can come from what is called a third-party marketeer, where they're doing the marketing, the hook, to then refer them to an agent that will change their plan. Now, how did they get your address? Well, that's very easy, because the credit bureaus sell their lists to anyone that is willing to pay for a list of, I want to know or get addresses within this 90210 zip code who meets this income criteria. How do you get on that list is because most people have credit cards. Most people at one time or another had credit, whether they bought a house or not, or got a Macy's credit card or whatever. So those lists are sold, and you've got to be very careful to read. And this particular card came to a Medicare beneficiary. That's why I blocked out their name, but it pretends that it's coming from an official agency like the Los Angeles County. Next slide. Here's another one, and I apologize, it looks a little vague, but trifold mailers. You know, the Social Security Administration, when they send you the your notice that what you're going to get next year, you know, your cost of living adjustment, or maybe there's some kind of a notice from Social Security. Sometimes it comes in a trifold and you've got to tear it on either side, especially the 1099s that are going to go out. Well, this looked like a government official notice, because it said, and what's really weird, on the return address, it said unemployment benefit guide. Well, I would say that a lot of people who are on Medicare are not working, unlike I. I love to work, so I still continue to work. But yeah, unemployment guide, watch out for. Another one that looks like an IRS form, a T2 card. Oh, I've got to fill it out and send it back. No, these are examples of printed material that older adults get and are targeted because it looks so official. And then once you fill it out and you mail it, that's it. They've got you. Hopefully, they're not asking for your Medicare number on that card, but you definitely will be getting a call from an insurance agent. Next slide. Here's another example. Special notice, Medicare and insurance information, deliver only to. And one of my friends happened to get this postcard. Read immediately and call for eligibility. And this was promoting back and knee braces. You know, the proliferation of promotion for medical equipment that, oh yes, you know, I've got a back problem, but I'm not going to fill out a card to find out if I am eligible for a back or a knee brace. I'm going to talk to my doctor about that. So be careful, because these unsolicited cards that a person gets is the hook to get your Medicare number and start billing for products and services that you may not need. Or we've had cases at HICAP where a beneficiary completed this card. They call them, this is so-and-so, you completed this card. We just want to verify your Medicare number. Please give it to us. And what they got in the mail was junk. Absolutely junk. It was flimsy. It didn't look like good equipped, you know, a brace. I don't recall whether it was a knee or a back brace. And on the return label, you couldn't even return it because it was so obscure. So be careful. Next slide. All right, these were some examples of what is, something is not right. Medicare Education Seminar. Oh, very official, with red, white, and blue. My Insurance Solutions. It was published last year, but it doesn't mean that this type of questionable marketing in print would continue. So if you see this particular one, doesn't even tell you what are they going to sell you. All right. It does say Medicare and Athena will show you how you can take advantage of the benefits available to you. Wow. Be careful. but it does say licensed sales agent, but it still does not abide by the new marketing regulations. Next slide. Okay, so this was another ad that I saw in the AARP bulletin. It has exactly information that would be required by the new marketing rules. It tells you about the Medicare open enrollment, which happened to be October 15th to December 7th. It tells you the who, what, where, and how. And of course, in fine print, it has a lot of disclosure, but it offers you some information about which company is promoting. And just remember, AARP is not insurance. AARP gets a lot of money from the insurance industry, specifically United Healthcare, to endorse their plan. So when somebody asks you, maybe you call the local HICAP, what's your insurance? Or your doctor says, what's your insurance? And you say AARP, no. AARP is not insurance. AARP is endorsing an insurance product offered by United Healthcare. Next slide. So if you wanted to know what is really available in your area, go to the proper source, the real thing, Medicare.gov. You know, a lot of, with the proliferation of computers and, you know, you've got iPads and so forth. Even I'm sure in your central room, maybe you have access to computers. You can go onto Medicare.gov and do some research on what plans may be available, or is it appropriate for you to even make a change. Next slide. Okay, so how do you detect if something went awry? Keep track of your medical appointments. At SMP, California SMP, you can order, and I'll show you some of the products that SMP can mail to you, but you know, your calendar. When I've visited seniors, they have this big calendar that is given by their church or some organization, and they keep track of all of their appointments, or maybe they have something small that they keep in their handbag. But keep a journal or a calendar of all the medical appointments that you have or that your residents have. That's a good suggestion. So that when you get that Medicare summary notice, you can compare, or the explanation of benefits if you're in a Medicare Advantage plan. You can look and see, oh, yes, I did see Dr. So-and-so, and it says in a description perhaps was a visit and so forth. We don't expect Medicare beneficiaries to understand all of the coding, but those explanation of benefits and the Medicare summary notice gives you a general idea of who, what, where, and when. Check the statements for accuracy. Did you actually go and see that doctor on the date that was on that MSN, the Medicare Summary Notice, or the EOB? Are the charges different than those for the services? You don't know if the doctor has upcoded, but one good example of upcoding is you go and see a podiatrist because you are diabetic, and I'm saying you in a very general term, and because you need your people with diabetes have problems with their feet, and sometimes they're subject to either ingrown toenails, or they need a little help. They may not have a good foot that may be bleeding or whatever. Well, we've had beneficiaries that have seen their Medicare summary notices where they've had toenail clippings for 15 toes. Well, that's already, you know, an alert there. Charges for services not rendered. Okay, there's a charge on a date where you may see a charge for blood work or x-rays, and they never did that. Charges, again, as I said, upcoding, services that are billed twice for this in the same day. You wonder, I'll give you a little tip about this. Doctors, especially if you're in regular Medicare, original Medicare, their billers sometimes make mistakes. And they will submit a claim to Medicare with what they think are all the right codes. Then Medicare processes that claim, and then they get their portion based on how that was billed. But that provider says, oh no, I need more money out of this. Something is not right. So they resubmit the claim with more information. That is totally out of your hands. So you may see, or you may get Medicare summary notices that show that they reprocessed it twice, but maybe they indeed made a mistake and they didn't submit all the right codes. Charges for services that were never ordered by the primary care physician, but yet you know, we've had clients that have said, oh yes, my doctor billed Medicare for, I don't know, some service that you never got. So those are examples of what we would like you to report to the Senior Medicare Patrol. Next slide, please. So what do you look out for? Keep track of your medical appointments so that you know when you get that Medicare summary notice or the explanation of benefits that it all tracks. Look for accuracy. Don't look for, well, I only spent 7 minutes with a doctor, but yet they got billed, Medicare got billed for this huge amount. Well, we are not, every code has a value, and a value is equivalent to you know, a certain algorithm, certain amount of time, certain amount of services. Whether you're with the doctor for 5 minutes or a half an hour, it may be the same code. So it's something that, you know, we've had Medicare beneficiaries report that, oh, he got overpaid because I was only there for 5 minutes. Well, that's a problem. But if you didn't see them, we definitely want to have you report it. And again, remember, look for services that either were billed twice or you never got or were ordered by the primary care physician, and that it matches your dates that you have on the calendar. Next slide. So what happens if you find something that's not right? Well, if you're in California, we want you to call the California SMP, 855-613-7080. But be as detailed as possible, because you are, or your residents are now the sleuths. We want as much information, and I know that Rose and her team, when they start getting reports, there's a lot of information that is going to be asked because we want that evidence. We just cannot say, oh, you know, so-and-so did it. That is where you need that evidence. Next slide. So some of the handouts that we have available for order are this particular one. Watch out, and this particular flyer can be posted in your bulletin boards, can be shared with, maybe you belong to the Newcomers Club or some other organization where you can post it. But watch out for those cold calls or the TV ads that offer absolutely attractive benefits that may be too good to be true. The mail that looks official, but it is really not from Medicare. And then you can also call your local HICAP, the Health Insurance Counseling and Advocacy Program, for free, unbiased information. So the Senior Medicare Patrol will help you with the reporting of questionable marketing or enrollments, but it really is the HICAP that is going to help you make sure that you are in the right plan. Next slide. So these are some of the handouts that we have available for order through the Senior Medicare Patrol, and many of them are available in various languages, specifically depending on the area. We definitely have the Spanish versions, but some of you may be in areas where Chinese or Tagalog is prevalent, and so we have those in those languages. And then the hospice fraud alert, when I did a research, it comes in so many different languages too. So depending on where you are, you may have a variety of languages spoken in that county, and you would be able to order some of the material in various languages. Next slide. So you can also sign up for our newsletter. And that is on our website, where we will ask you for your first name, last name, and your email address. And you can check for the buttons that you want, the Medicare updates or fraud alerts or upcoming webinar announcements, of all of them. And being on our mailing list, the emailing list, electronic emailing list, we would be able to send you announcements of something that is current, or what is happening. Maybe we are going to be doing another seminar tomorrow, for example, on this same topic, but also our partner, the Center for Medicare Advocacy, is going to be doing a review of how did the annual election period work out. Next slide. So these are additional resources if you ever wanted to, take the bull by the horn and report inappropriate behavior. All insurance agents have to be licensed by the State Department of Insurance. In California, it's called the California Department of Insurance. And what they like to have is a copy of their business card, because it gives the investigator the number, their license number. The HICAP can submit a complaint against that insurance agent, or you can actually download the form on the department's website. Nationally, the HICAP is called State Health Insurance Assistance Program, SHIP, but locally we are called HICAP. And the 800-434-0222 is the statewide phone number for California's HICAP that routes the call, depending on where it originates, to, in most cases, to the right HICAP. The next slide. Okay, so again, to repeat, we've got the phone number for the SMP, 855-613-7080. We have the national phone number, 877-808-2468. And then also, if you wanted to find out where is the Senior Medicare Patrol in another state, you can go onto this particular hyperlink, smpresource.org/contact us. Marketing rules, if you really wanted to dive in and educate yourself on what the new marketing rules are, here we are. And then, of course, our phone number, California Health Advocates, with our website, where we have available a plethora, a bunch of information that may be very useful for you. And this concludes my presentation. And I thank you, and we're open for questions or comments.
Thank you, ladies. I appreciate all the wonderful information and time. Does anyone on the call have any questions or things that they would like either Rose or Tatiana to touch on a second time? Then feel free to
Hi, this is Joe Stephanie. I do have a question or comment maybe, and it has to do with the news report on MSN about seniors being stuck in Medicare Advantage plans. And I just wanted to know what your thoughts on that, Tatiana, are.
Yes, I appreciate that call. That is MSN NBC. Is that what you're talking about?
Yes.
Oh, okay. Yes. Well, individuals who were enrolled inappropriately or did not change their coverage during the last open enrollment have the opportunity to change between January and March. If they succumbed to an inappropriate enrollment, and this is particularly of interest to SMP, because then we will work with the appropriate governmental agencies to see if we can make that individual whole by returning them back to their original Medicare and or their old plan or their Part D plan. Sometimes it was just a Part D plan that was changed. So technically, a person is really not stuck in their Medicare Advantage plan if they were inappropriately enrolled. Other times, and there are times that this happens, in particular for long-term Kaiser enrollees. There's nothing wrong in general terms with Kaiser, but because Kaiser is an HMO, you cannot go out of that plan unless you get a approval from the plan to see a provider outside of your network. Some people feel that they're stuck in Kaiser. Yes, no, and maybe. The key here is if a person wants to get out of their Medicare Advantage plan, there's certain times in the year where they can do it, unless they were bamboozled into a plan. But the fear of the continuity of care is very important, to recognize. And in particular, if a person is in Kaiser, they've seen their doctors for years. I've had beneficiaries say, I was born into Kaiser, I married into Kaiser, and I probably will die in Kaiser. Well, that's a problem, because trying to find a provider that has open practice, that's number one, is going to be difficult. So what does a person do when they think that they are stuck? If we're not dealing with inappropriate enrollment, the local HICAP would be able to assist that beneficiary with figuring out what is getting in the way of continuity of care. Maybe they need to file a complaint against the plan with Medicare. So this is where getting stuck has many ramifications, and that is where the HICAP needs to know, if it's not a fraudulent enrollment, needs to know, why do you feel stuck and how can we fix this? I hope I answered that question. Any other? Yes, Stephanie, hi.
Hi, thank you so much for your presentation. It was very helpful. I have a question about, what if you suspect someone or several people that are engaging in fraudulent activity with hospice, and they're using their Medicare? How do you check? Because I've confronted, and I confronted some individuals, and they'll say, no, I'm not doing that, and the pharmacy comes here and they're delivering medication, and they started doing it on the weekend because the staff started questioning these pharmacies that were coming. I did a lot of investigation on this, and they're paying people. Someone is paying people money to utilize and to recruit. So would it be fair to, or is it possible to check their Medicare number and find out what plan they're in? And if it says
Yes.
hospice, is that the way to go about it?
Absolutely. Okay.
Okay.
So one way that either SMP or the HICAP knows what plan they're involved, because I am a registered counselor with HICAP and I have a unique ID. I can call Medicare and ask them, what is their coverage? Are they in a Medicare Advantage plan or are they in original Medicare? Are they, if it's hospice in particular, the hospice network is so insidious. And I don't mean that all hospice agencies are that way, but they will pay others to solicit enrollments into hospice. And when you are in hospice, you cannot get your regular medicines.
Right.
And
So what I've learned is that they will, once you go to the ER, hospice is cut out and then it starts over and you have to re-enroll because you're not supposed, when you're on hospice, you're not supposed to go to any other doctor or go to the ER.
That's a misnomer. That's a misnomer. Yes, because if a person, and I have been with friends who have been on hospice and truly dying, sometimes they are in a condition that the family cannot tolerate their end of life stages, and they have to be transported to the hospital for continuity of proper care in their dying episode. Okay, but it is true that if a person is inappropriately in a hospice plan and breaks a leg, for example, okay, hospice is about comfort care. So if you need to have your leg stabilized, it's possible that hospice could cover that particular comfort care by caring for that leg, but it doesn't mean that they would go out of hospice and then have to come back in hospice. But sometimes, yes, getting medical care depends on the situation. And that is where we've had, as I said, I think I mentioned, somebody was enrolled in a hospice program by a hospice agency inappropriately because of all of these other, you'll get a hospital bed and you'll get your meals and you get all of this fancy stuff, right? And then they couldn't access their cancer treatments. And they didn't want to be on hospice. So we can get them out and get it properly fixed. Yeah. Any other questions?
Thank you so much.
Oh, you're welcome. Well, as I said, please contact Rose or the phone number that we have sent you. Rose, did you want to give any final notes or words?
I think we got everything covered on our slide, but I do have a colleague that's going to be working with me closely. Her name is Reina Alvarado, and you could reach her as well on our 916-848-0249. That is our fax number. And you could always call us directly on the SMP number. Either one of us will reply back to you guys.
Right. And important is the evidence, get as much detail as you can get, whether it be a business card or some flyer. I saw a flyer once at an assisted living facility for diabetic shoes. Well, yes, no, and maybe you would be eligible for proper diabetic shoes. But it was a hook. Yeah. So I thank you for being on the call, and I appreciate the kudos and hope to see you again soon.
Yes, thank you, Tatiana. Thank you, Rose. We appreciate you. And thank you
Thank
to all our
you.
members who were able to join. I will get a copy of this recording sent out just as soon as I can.
Thank you, and have a good
Thank
week.
you.
Bye-bye.
Bye.